project here is to introduce you again. I know most of you are familiar, but we'll give a quick review today of the project, and hopefully in the next session, Adria will give you the real insight into the details of the portal. So without any further delay, I'll go ahead and again welcome you on behalf of the core group, Fran, and the work group chairs. So these are the members. As you call your names, we have a great group represented from pretty much from several different regions of HRSA. And before I start, if you look at the bottom of the slide, the collaborations are between Southeast Regional Collaborative, which is a grant funded through HRSA, or Health Resources Service Administration, like a sister agency, NIH, and GMDI, the Genetic Metabolic Dietitians International, who you all are members for. And this project will be housed eventually once the grant period is over with the GMDI. So today's agenda includes our guideline development process. I'll give a quick introduction. Adria will just give a very, very, very quick the portal, and you'll have a detailed overview on Friday, November the 21st. Diane Frazier, who is the champion in helping us lead the first guideline, would discuss we will all benefit from her tremendous experience of guiding a team for MSUD guidelines. And of course, you guys have worked with Keiko and Elena to develop the research questions, and as the chairs, they will review those questions with you. And Pat Splett, who is a PhD-RD working as a consultant to a project and has a tremendous experience with Academy, will review how to extract key information from the research. And then there'll be some homework given to make sure we all know how to use the tools and the assignments. Then Pat will be available for the training session for the evidence analysis training, extraction of the actual article, followed by how to use the portal. So we all are on the page how to actually extract an article in the way with our compliance with the methodology using the tools that have been created by Adria actually here, who's our, and she'll introduce herself later to you. Okay. So what we decided was, because we are very appreciative of the time we are volunteering and we don't want to run over, so we are going to pretty much hold on the questions until the conclusions of the training sessions. Please take a piece of paper and pencil and write your questions and thoughts as you go along, so we can, in the end, spend a little bit of focus time to answer the details of the questions instead of being interrupted in the middle. Okay. So again, this methodology we had developed about developing recommendations includes not only the evidence from the literature and the gray literature, which we'll talk about, but also a very systematic way to obtain consensus from the groups. Next one. Okay. So as you know, we have shared this, that it's a very simple vision. What the dietitians wanted was, based on several focus groups we did, online resource with best available research on nutritional management of inherited metabolic disorders in a friendly format. So our whole charge, the ultimate goal is to develop, to create best practices based on the best evidence and the best consensus at this time. So as you will hear these terms, I thought I'll tell you, and you probably are all familiar with this. In 2007, American College of Medical Genetics was charged by the Maternal and Child Health Bureau to create what you will hear the word term RUS discussed nationally, which is the Recommended Uniform Screening Panel. Because in the country until 2007, there was no criteria or guidance from the federal government and every state was screening different things. So there were primary targets, which most states do, and secondary target is the term used that those were not original recommendations, but as the people were looking on the tandem aspect for these, they came across these metabolites which they thought would possibly also be treatable. So our project goals are to take the latest scientific evidence and expert consensus and to collaborate. So the collaborations which I want to talk of GMDI and CERC are very, very clear, but we have talked with Academy, and I had another conversation just last week about how to continue to, in the future, look, we were not large enough numbers to form a special practice group with the Academy. That's why we formed the GMDI to start with, but they're still very interested in working with this group and keeping us involved, and we are continuing to have some dialogue, and I'm sure we will continue to have that dialogue through GMDI too. But also American College of Medical Genetics, we are in touch with them through our HRSA grant because they coordinate all the centers which are funded through HRSA. In the Society of Inherited Metabolic Disorders, we continue to extend our outcome of a product set meeting and with posters and stuff and keeping them posted, and we'll continue to explore. So these are the agencies we are focusing on right now. You will hear about a standardized methodology we have developed and created and a technology infrastructure to house this project. Our organization structure, which was developed, is something like this. We formed the National Advisory Board, which had members from SIMD, ACMD, American Dietetic Association at that time, or Academy now, and several others to give us guidance to say if this project was worth, and of course, it was approved. We have a core group. On the left-hand side in yellow, you will see this is the infrastructure building big team here funded through the grant, and we have several of you volunteering hours and hours of time to the categories which are listed there. And as you know, MSUD has been completed, PKU is near completion, and now we are starting with the propionic acidemia as one of the first organic acidemias. Okay. And these are your wonderful, gorgeous work group chairs. The pictures taken, I think, in 2007 or 2008. So, and this is the pictures of CERC staff. So you know the people who you would be communicating with. Acha, who's been doing a tremendous job as a project manager. Katie is the doctoral student, actually, who works as a lead evidence analyst, and Alana also as a lead evidence analyst. So when we had quickly looked at the Academy's process, it did not work. I'm going to quickly just flash that it proves defining the question, determining criteria, literature, analyzing, and developing conclusion statements, and then publishing. And we felt we didn't have enough strong evidence literature to move through this, so we put the consensus component. If you go to the next, please. And we published this manuscript based on our findings, which if you have not read, I would encourage you to read our methodology before you start on this project. And this diagram is from that manuscript. And we fondly use the term DNDF methodology, D standing for the Delphi process, and for the nominal group, where we bring the experts together to work through any issues which have not been have a consensus through our Delphi or questionnaire method across the country. And then again, we do a second questionnaire or a Delphi based on the findings from the nominal group. And finally, we hope to, whatever we develop, see if practical application or the field testing, how the dietitians are utilizing this. Next, please. Just keep going. I've already addressed this. So the technology infrastructure is for this. The key thing about this project is that it's taken us a long time to this D&F methodology with the technical infrastructure, which is web-based. It's interoperable. We are trying to make the terminology very standard with National Library of Medicine guidelines. It's transparent. It is open access. It's secure, and you'll hear more details about this. And using this methodology, as you may already be aware, we have published a couple of papers for the which is the MSUD one, actually, but also we did the preliminary work with the recommendations of PKU, which was not using this methodology with the American College of Medical Genetics. So we will be updating with another manuscript by early next year, which we have completed following these recommendations using our methodology. Next, please. So this is the paper from the disease work group, which has already been published and was released in 2013, and that's available, and Diane will discuss more of that. So in future directions, one of the things we are working on, which was a request, was a toolkit for professionals that will be available. We have submitted our guidelines to the most stringent agency in the country, to Agency for Healthcare Research and Quality, which published all the guidelines, American Heart Association, evidence, and they have accepted our MSUD guideline to submit to the board as of last week. And also, we are seeking international collaborations, and French group has already approached us to see if they can translate in French. So we'll continue to explore that as we move. So with that, I will end my little presentation, and so that you can have this broad concept before you start working on this project. Before I turn on the presentation to someone else, Fran, do you have a word to any comment or anything you would like to add?
No, I just want to thank everybody for joining, and especially people who have sort of started and stopped throughout the years. And I think you'll see, we developed this methodology and this infrastructure so that now it should be smooth sailing, and I think you'll see as we go forward. It sounds a little overwhelming in the beginning, but it will reveal itself as we go. So thank you for joining.
Okay, so what we're going to do next is we're going to take a look at the Nutrition Management Guidelines web application, which we all lovingly call the portal. And the purpose of this initial look at the portal is just to give you a taste of what you're going to be working in and working on in a few weeks. This is the Management Guidelines portal homepage. At the very top of the page, you'll see a dark purple navigation bar. And if you were to scroll or hover over guidelines, you'd see there's MSUD guidelines which have been previously published. The MSUD guidelines are here, and Diane's going to go into a little more in depth in that. We're just going to take a quick look at this now. So some of you have already registered with accounts, but we're just going to go a quick walkthrough on this process. Registering requires entering data requires a CERC account for and accounts will be provisioned at the conclusion of our third training session on the 21st. The link to register is southeastgenetics.org/register.php. If you go to that link, this is what you're going to see. You'll enter in a username and a password and confirm password. Be sure to jot down your CERC username, as you'll need it for accessing other resources on the portal. And you'll enter in your agree to the terms of service, and you'll enter in your details. The portal is located at southeastgenetics.org/NGP. The link is available on the CERC website as well as the GMDI website. So logging into the portal is handled through the link at the very bottom of the page. I've got circled in red now. You'll enter your CERC username and password. If you forget your password, you can click the link below the login button, and that will be taken to the CERC website where you'll enter your CERC username and a CAPTCHA code. That will send you a link to reset your password. As you log in for the first time, you'll notice that at the top of the site, the purple toolbar now has some new buttons. One of the buttons is Work Groups. You'll be working off the Work Groups button quite a bit. The two buttons that I'd like you to focus on now are the Probe link and the Discussion Board link. The discussion board is available to all workgroup members from any page in the portal. They'll use the forum to ask questions and get advice. Workgroup chairs and Emory staff monitor and participate on the forum. The discussion board login is separate from the forum, however, it uses the same credentials as the portal. So you'll use your username and password that you created for the CERC website and the portal. You'll access the discussion board by scrolling down the discussion board and clicking the link. And that will open the discussion board in a new tab or a new window. A how-to document will be provided to you at the conclusion of this meeting with a little more in-depth usage on the discussion board, a little more than we can get into right now. The workgroup page for propidemic acidemia will be the other area that you'll be working out of quite a bit. And as I show you some screenshots from the portal, don't write down notes or don't focus on this too much right now. We're just giving you a little taste of what you'll see in a few weeks. So this is the workgroup page where really the heart of what we do takes place. This is where all of our literature is added and analyzed. You'll be working on something called the overview table, which Pat will go into great detail on in a bit, and we'll also have another training session on November 21st. So this is the overview table statistics graph, and clicking that will bring you to an overview table index where you can see all the workgroup members and the work that they're doing. And this is an example of one of the overview table entries for Fran. Again, Pat, Keiko, and Elena will be going into greater detail of how to use this and the methodology and process. So please pay attention for this upcoming presentation from Pat. A separate in-depth training session will be provided to you on November 21st for entering data and using the portal. So with that, I'd like to pass it over to Diane, and she will give you a little background on the MSCD guideline development process. I'm sorry, Diane.
Thank you. I really want to, excuse me?
Yes.
I want to hone in on the role of the abstraction and evaluation, which is the process that we're going to be spending a lot of time talking about. In using the MSUD guideline as sort of an example. So when we began with the guideline, just as you did, we identified 5 research questions, and we lovingly called them, the first one, illness, the second one, blood levels, etc. So, but I'm going to just hone in on 3 to use an example. So for the individual with MSUD, what is the most effective method for initiating, dosing, and evaluating response to thiamine supplementation? As in all research questions, what we found was that there were just certain areas in terms of what we could find published that just were not either clear, or there was some a difference between opinions about how things should be done, which have directed us to decide that these were questions that we needed to do a much more in-depth look at the available evidence. Next slide. So I'm going to actually hone in even further and take one article that came up in the literature search for the use of thiamine in MSUD. This is assigned F109. This was a peer-reviewed article, the type of articles that you all will be doing the analysis for and entering onto the overview page. So this was actually an article way back in 1985 called the Thiamine Response in Maple Syrup Urine Disease in Pediatric Research. I'm not going to give you the entire overview table information, but to sort of summarize it, what information came from that paper. So it was a systematic study. They had 4 children. They were between the ages of 7 months and 9 years. And they were able to find that 150 to 200 milligrams of thiamine was sufficient to decrease the plasma amino acids by 37 to 66%. And this took about 4 weeks in 3 of the 4 children. But they did find that one child who had very, very low activity of the enzyme did not respond to the thiamine. So basically, that was the information we garnered from this particular peer review article. Next. Okay. So what we have here is a number of peer review articles that were related to thiamine, but I just wanted to show that that is one part of the information that informs the so-called conclusion statement, which is really the next step after we gather all of the evidence. But keeping in mind that it is the peer review literature, and these are the articles with the F numbers that have the most strength of evidence. When these things are evaluated, we look at the information that comes from the Delphi surveys, the information that comes from the Gray-Lit, and the consensus from the nominal group all will inform the consensus statement, but I really want to emphasize the importance of the work that you'll be doing on the peer review literature in the process that you'll be working on the overview table. So next. So for this particular research question on thiamine, we come up with a conclusion statement. I'll just briefly go through it. And this is all pulled from the information that we get from all 4 sources. The peer review article F109 actually contributed to this conclusion statement with some of the data that was pulled from it, and I just highlighted that in blue. We got some information about what the thiamine dosages should be, the fact that only those with some residual branched-chain keto acid dehydrogenase activity actually respond to the thiamine, and that the time that it took to see a response usually within 1 month. So I just wanted you to sort of follow through where that one particular reference gave us information that we could use in the conclusion statement. Next. So once we have our conclusion statement, it's time to write our recommendations. And for research question 3, there were 4 recommendations, and we're looking here at the first recommendation that goes with this particular research question, and that recommendation is that to perform a thiamine challenge in all individuals with MSUD except those known to be homozygous for the 1312T2A mutation or other mutations resulting in less than 3% BCKD enzyme activity. After each recommendation, we have the evidence, and I didn't write it out here, but just wanted to mention that there were 9 references, including this F109, as well as gray literature and consensus statements from both the Delphi surveys and the nominal group process. So we have, going from the beginning, we have our question, our search of the library to gather the peer review articles, and we then can see how that information from the peer review article informs our consensus statement, which then allows us to write a recommendation, which we then add to that recommendation all the evidence which supports the recommendation. Finally, we have someone who will then give that recommendation a grade based on the strength of the evidence. And you can see that in the next slide, which is really what shows on the portal at the top. It's obviously very small, but there is that conclusion statement. And I have clicked on the details under it, the box, which lets us see the entire information. So recommendation 1 for question 3 is there. It's actually given a recommendation grade of fair, which actually is not a bad grade. And then we have the evidence, and for anyone who wants to look at that evidence, they can click on the particular F number, and you can see our F109 right there in the second line of the evidence. And after that, we also have the consensus information. So I hope what I've really been trying to show you is how your part in this, in terms of looking at these literature papers, comes full circle in the end, and how it informs what we want, which is recommendations for the treatment of PROP. So finally, I like to eat, I like to cook, and I just always like to use analogies. So if your role in the pastry kitchen is to chop the pecan, you certainly do need to know about the other ingredients, the mixing and the baking instructions, and you need to get a taste of the final product, which in this case is our MSUD guidelines, to understand the importance of your role. Thank you.
Next, Elena and Keiko will review the questions. Your questions now.
Hi, thank you. It's Keiko. Okay, so thank you again, everyone, for being on the call and for volunteering your time. We're so excited that you're here and to have your help and to work with all of you. So to bring it down to PROP, as we thought through our main research questions, we found that obviously there's a lot of similarities between disorders of the questions that we ask about the proper medical nutrition therapy. So for propionic acidemia, we started out identifying sort of key questions, which really drove the Emory librarians' search for us for articles. So our first question, sorry, next slide, please. Our first question, of course, is a pretty broad one, but focusing in on specific nutrients. So what nutrient intakes are associated with positive outcomes? And so we're looking really here at how much protein do these patients need in terms of total protein, in terms of protein from formula or medical food, and then certainly protein from natural protein sources, such as infant formula or cow's milk added to formulas. You know, and then questions about the restricted amino acids, how much should we be giving these patients of the restricted amino acids, or how much of a restriction should we be giving them, what are their calorie needs, what are their essential fat needs, looking also at specific vitamin minerals. So this question is really focusing on nutrient intakes. Question 2, sorry, next slide, please. Oh, sorry. So as examples of papers that were found that related to that question 1. This is just sort of an example of a few papers that were found for question 1. We actually found about 25 papers in our pool of propionic acidemia papers. And so Fellett's article in 2000, just to show that as an example. Can you go to the link on that, Adria?
I can try.
Oh, thank you. So that one really addressed energy needs, and it was an interesting paper. Hopefully that will work, but if it doesn't, it's all right. So just to go into the specifics a little bit of this paper, it talked a little bit about measuring REEs for, oh, thank you. Oh, that's better. Okay, so measuring REEs for 3 patients with propionic and then 11 with MMA. So you'll find as we go through all these papers that, of course, a lot of them are a mixture of propionic asthenia patients as well as MMA patients. So since we're doing propionic first, we really want you to focus on the data as best as possible and as best as you can with the information given in the papers. On the propionic asthenia patient data that was given, and then to decide, their conclusion statements, is it related to our patient population of propionic. So this is a good example of a paper, a research paper that looked at energy needs for propionic patients. We have also reviewed, so there were 2 types of papers that were defined. There were research papers such as this one, which of course there aren't a lot of these papers around for us, and then there were a lot of review papers. So both were included in our search. Sorry, Adria, can you go back to that main slide? Thank you. So Queen's articles, now some of these other articles were a little older, addressing protein amino acid needs. Of course, the older papers often, I don't know if the ethics boards weren't quite as organized as they were now, or we have certain limitations, obviously, in what we could do to manipulate diets for patients. But a lot of the older papers gave us a lot of good information. So we did include that, although we did have a cutoff, I believe, of 90. It sort of changed. And then we included some exceptional papers that were older just because of the data that was included in them. And the third paper here talked about essential fatty acid needs. Next slide, please. So question 2 goes through what nutrition interventions are associated with positive outcomes. And so here we were really wondering about what is the right diet to start for a newly diagnosed patient. What should we do for acute management during illness or metabolic crises? What's the right choice of formulas for them? How do we calculate the diet properly? What kind of social and educational support issues do we need to think about? When we think about their enteral nutrition or parenteral nutrition, what is it that we want to recommend the dietitians do? And then what do we need to think about in terms of chronic dietary management for these patients? And then next slide, please. And some examples of papers for that question. So you'll see that there were some really good papers addressing chronic dietary management. Some of them, again, were older, but we tried to focus on those specific topics related to each question. So this first paper talked about chronic dietary management. Ogier-de-Balny's paper in 2002 talked about acute management. Thomas's paper talked about the initiation of diet. We have a big pool, actually, of papers that were pulled for question 2, some about, I think, 75 or so papers that seem to address specific issues around question 2 are available for us to review. Next slide, please. So question 3, do specific nutrient supplementation or other treatment modalities improve outcomes? So here we were really focusing on questions about biotin as a cofactor, carnitine dosage, exactly how much do these patients need and what's best for them, what are their other amino acid needs, how do we use probiotics or laxatives in these patients, what do we do with Flagyl, and some patients are given nitrogen scavenger medications like buphenyl, or even Carbaglu at certain times of crises. So what do we do with that? Some patients are given insulin a lot of the time, mostly in the initial acute phase, or if they're very sick and metabolically unstable, to promote anabolism. Some patients are given growth hormone, and then certainly there are other medical and treatment modalities that people are thinking about for propionic. some examples of questions of papers for this question. From 2010, Ribas and others did a nice article on carnitine supplementation. Schwann and others in 2010 did a really nice article on use of carbaglu. So for this question, there were about, I think, 24 or so papers that involved those specific topics. I'm going to turn it over to Elena now so she can go through the remaining 4 questions.
Thank you, Keiko. Going on to question number 4. First of all, I just wanted to ask, I guess we're not taking questions to the end, so don't ask me any questions. Sorry about that. But on question 4, we then move on after defining how to determine their dietary prescription as well as supplements. We want to know how to monitor to assess the outcomes. And of course, this isn't going to surprise you that we're going to look at their growth via anthropometrics. We're going to do food records to assess their nutrient intake and adequacy. We're going to look at various biochemical parameters, DEXA scans to look at nutritional status. Of course, we have to look at their metabolic status. We've got to look at their acid-base status, organic acids, plasma amino acids, acyl-carnitine profiles, and so forth, to get a better indication of how metabolically stable they are. And that's a challenge in this disorder. We also want to look at their general overall clinical and health status, immune function because of the bone marrow suppression that propionate can provide. And ultimately, the final outcomes is how are they doing developmentally, what are their quality of lives, what kind of patient-reported outcomes are they providing? I mean, if they're in the hospital all the time, are they able to carry on a certain amount of activities? Are they able to continue with their development? And then what kind of activity level, because that really has an impact on the caloric prescription that you're giving these patients. So moving on to the next slide, I just provided some examples. And it's, I think it's going to be fun, but it's going to be challenging because there's still no real clear biomarker to establish a relationship with metabolic control relative to their plasma amino acids, ammonia, acid-base status, and so forth. And there's a series of manuscripts that discussed various approaches. And the first one with Al-Hassan that was published in 2003. They are looking at the relationship of plasma amino acids, ammonia, plasma acids, acid-base status, and they're looking at them together, finding very poor correlations with glutamine and ammonia, but finding good correlations with glycine and serum bicarbonate, suggesting that the glycine and acid-base balances might be a good approach to managing these patients. So we're going to look at various approaches and see how effective they are. The second one involves a case report looking at the urine organic acid profile, and the typical organic acids that you would see is 3-hydroxypropionate, propionyl glycine, methyl citrate, and tigloglycine, and their relationships to when ammonias are up, carnitines are down, and glycines are up, along with acid-base status. Unfortunately, that's what you're going to see a lot in the literature is case reports because of the rarity of this disease, and that's what we kind of have to look at collectively is these series of cases to try and understand what the best parameters are to help with managing these patients. So if you go to the next slide, and then we want to look at various special circumstances of individuals with propionic acidemia. I think we've been more successful over the years, particularly in some centers that have quite a bit of experience to pick them up, diagnose them early, rescue them from their metabolic crises, and now they're growing up and we're dealing with issues of adulthood. And specifically, one of our questions are regarding women and the nutritional therapies associated with positive outcomes. We know that menstruation can become an issue with the hormonal changes, pregnancy, that labor and delivery, and particularly the postpartum with the involution of the uterus, you have a big protein load and that can cause some serious consequences, as well as lactation. And then finally, if we're ever so lucky, is to deal with menopause. So if you go to the next, we are very thankful for Sandy Van Kalkar's work in sharing a case report of a woman with milder propionic acidemia along with a woman with maple syrup urine disease and sharing how she managed this patient through her pregnancy. And then in the paper below is another case report that discusses 12 women. Of course, only one of them has propionic acidemia. So again, we're dealing with case reports talking about pregnancy, labor, delivery issues, and also they focus on some pre-pregnancy counseling and emphasize the need to manage these women at high risk. Next slide. We also want to address those special circumstances that you're coming across and how to ensure a positive outcome with propionic acidemia associated with secondary complications. I think many of you are aware of the cardiomyopathies that have been reported with propionic acidemia. We're seeing episodes of pancreatitis, which are very tricky to manage in this disorder, as well as diabetes, because this is a mitochondrial disorder, and unfortunately, that's a consequence as these patients get older. We also have the issue of their neurologic status, which is compromised, leading to the need for enteral nutrition support, compromising their activity level, hypotonia, and then other, and another big bucket of other, which I kind of alluded to in the beginning is, you know, as we're managing these patients and we're successfully helping them survive through childhood, how do you handle the transition to adulthood? And that's something that we need to look at and address as well. So this is kind of our potluck question about all those other circumstances and trying to ensure that we address it. Obviously, this will be a question that we come back and visit over time as we learn more about this disease and as these patients grow older. So examples of articles that you'll see with this, again, we're dealing with a series of case reports that talk about, you know, the immunodeficiencies associated with this disorder. A case of an adult with cardiomyopathy, 23-year-old woman, and they talk about the possible mechanisms, how to diagnose it early and the appropriate management. And then finally, there's a case report of pancreatitis and how they went about in dealing with these recurrent bouts, which are really challenging. So, you know, that's what we have to look at as a series of case reports. And finally, our final question is liver transplantation, because many of the more severe propionic acidemia patients have been looked at to have liver transplantations, and we want to evaluate the number, the success rate, the criteria for having the surgery done, and what kind of nutritional intervention is needed pre, post, as well as during the operation, because these operations take many, many hours, and what kind of special considerations are made for propionic acidemia and the transplantation. So just to give you an idea on the next slide of cases, again, you're dealing with case reports. The first one by Saudebre, actually, it's a really nice overview. So they focus on liver transplantation. He actually has another paper that talks about the 33 patients that he's followed over the past 20 years. And this particular paper focuses on two individuals, a 7-year-old and a 9-year-old who had orthotopic liver transplantation, and they provide a lot of good information on managing these patients. The second paper talks about 12 patients, and 14 had the oligo liver transplants with a 72% survival after 1 year. And they talk about some of the complications as well as the improvements in outcome. And then finally, the third paper, and the reason why I'm bringing this up is because it's also Saudebre, and they're talking about the two same cases that were in the first paper. So that's something that we have to be cognizant about, that, you know, here's one paper in European Journal of Pediatrics and the other in Journal of Inherited Metabolic Diseases, and we really can't say we have 4 case reports. We have, actually, it's only 2 case reports, but providing possibly some additional information on these 2 cases. So that's everything that we have, and as I said, because of the time constraints, we have to hold the questions at the end. But it gives you an idea, and I just wanted to make one other point, that by all means, the subtopics that we identified for each of the main questions are not conclusive, and we're expecting to get input from all of you in our work group as we review the articles that address these questions to more fully develop our management guidelines. So that's what I have to offer.
Thank you. And I think now we'll get to the nitty-gritty of the work, how we'll be doing the work in the trenches, and Pat will, I'd like to Pat to lead that abstraction session.
Good morning. This is Pat. Can you hear me?
Yes.
Okay, great. Thank you. So now we are going to get into the nitty-gritty. And so what I want to do today, or today plus when we talk again 2 weeks from now and later, this is what we're really aiming for, is that you would have an understanding of the role of the analyst abstractor and what's expected in the abstracting phase. And we're aiming toward a uniform process for selecting and abstracting pertinent information from each research article and putting it onto the evidence worksheet. And as you get into this, we are expecting, and what we've seen in other projects, is you develop greater skills, greater confidence, and greater speed in doing this. Next slide, please. Okay, so we're going to focus now on the abstracting phase of evidence analysis. And as Ronnie went over the DNDF methodology, you know, it has many steps, but we're in the first phase that feeds into this, where we're just saying, what is the information out there, and how can we pull the scientific basis, which is the foundation of where things start off. And if you see this list of the steps of evidence analysis, we'll be focusing on step 3, which is the abstracting. Next slide, please. And this is a picture of it, which allows you to kind of see the role that different players have in this process. And down the left-hand side, the expert work group. So many of you have been on the work group from the beginning, which began with developing the questions. And then it goes back and forth, review of the literature and through the project staff and so on. But down at the bottom right-hand is the evidence analyst. And so the job here is to really focus on the reviewing of each individual article as it stands by itself. And that actually has 2 phases. One is to examine the quality of the study, that is, how good the research was conceived and conducted and carried out and reported and so on. The project staff back at Emory, they have a group of analysts who will take each article and do that appraisal. And so when the article comes to you, your job is going to be to extract the pertinent information that relates to a specific question. Next slide, please. And so your role is to objectively identify pertinent information from the articles, critique its relevance to the project questions, and abstract information onto the evidence abstract worksheet. And so if you think about that, here's your responsibilities: to review and abstract assigned articles in a timely manner. And what timely manner, what does that mean? I think that in the terms of moving this project along as quickly as it needs to go, we're really thinking about a turnaround time of about 2 weeks. So if you're assigned articles, you know, find time in the next 2 weeks to do them and get it back. Accurately enter that information into the portal, and you will, in a subsequent training session, be kind of guided through the steps of using the portal. And then communication is really important. So you can communicate with the project chair if you have questions about the study content in a particular article, the use, what are we going to put on the evidence worksheet, or, the content kind of questions go to project chairs. But if you're having questions about how to use the portal, what your assignments are, and so on, then you would direct those kinds of questions to the Emory staff. Next slide. So when you have reviewed an article and put it onto the portal, this is what your work will look like. And you see there a sheet, a table, then, that has sample size, intervention, outcomes, limitations, and the conclusion that you derive from that review. And I'm going to be talking through each one of these columns, and I'm going to be relating it to the article that you read. So hopefully you can see how the pieces fit together and think about how we drew this information from that article. Next slide, please. Okay, I did mention that each one of these papers goes through these 2 levels of being reviewed, and this shows you that the quality appraisal it has been previously done, or it's an example of that. And here you see the citation, and you can see there in the middle of the slide it says study design, so it tells from a scientific point of view what is this design that's been used, and the class really has to do with where in the hierarchy of research does this particular paper fall. And A would be best, and those would be the randomized trials. And going down, D is where you would have more descriptive studies, including things like case studies. And then the last thing there says quality rating, and papers get rated as a plus for positive, 0 there for neutral, and a minus if they're falling short of many criteria for a good scientific paper. So you won't have to worry about it. It's nice that we have the folks at Emory and graduate students and with all their recent finesse about understanding research methodology that can go through that process for us. Just back a second. The one thing is that, just to point out, is when does this come into play? When all of this evidence that has been abstracted from the papers goes back to say, how do we come up with that conclusion statement that Diane had illustrated? At that point, people might go back to this and say, now, how good was this particular article? And that might help have some impact on what kind of weight is put on that particular paper, that particular evidence when you're pulling everything together. So that's the background, and then your job's going to be to complete 5 columns that's on the next slide. So this is what this table or worksheet looks like, the headings. But what I do want to point out here is that the first 3 columns are where you are going to the paper and abstracting details as they're presented in the article. So there's no interpretation, no translation. You're just repeating the facts stated by authors. And what that includes, say if you're reading a paper from the 80s or the 90s or sometime in the past, they might have used different measurements, or they might have different labels or jargon for things. And we want to not translate it into a current usage, but report everything as in the way it was reported at that point in time. So it's kind of just the facts. But when you move over to the last 2 columns, the limitations and the question conclusions, this is where you put your expertise on to make judgments. And here you want to say, from looking at the article, did I see any problems or issues that should be kept in mind? What is the takeaway message that we should, draw from this? And so the last 2 columns is where you're going to apply your judgment and really think about how are we going to use this information as we look at how it fits in with the research question. Next slide, please. Okay, I want to just point out for a minute the anatomy of a research article. And of course, you all know this. It starts with the background, what's known about this particular topic. It gets to, at the end of the background or introduction section, the author says, well, this is what this paper is going to be about. And then the methods describe their plan and how they did everything, and then it gets to results and discussion and conclusion. Okay, no big deal about it, except as I go on now, I'm going to remind you where to look in a paper to find certain kind of things. But the other thing I want to point out on this slide is the absence of the word abstract. So if you have a reference, you go to PubMed, the first thing you see is the abstract. You download a paper or look at a paper, and it starts out with the abstract. What I want to remind you to do is don't look at that brief summary. Don't take information out of the abstract. Your job is to really go through the methods section very carefully and say, what are the details about how they did it, who was involved, and so on. And the same thing with results. In the results section, they may have a lot of information that goes well beyond the 1 sentence or so that was included in the abstract. So you're really looking in detail at the article itself. And of course, the discussion and conclusion are also important. But you know, the abstract is just the starting point to kind of give you an overview of what the article is. Next slide. Okay, so now we're going to go to this table, a worksheet, and the first column was sample size. And so the question you face, the first question is, well, what am I going to put in this column? The column heading is called sample size, but I want you to think broader than that. This is the column where we're really saying who was included in this study and where did the data come from. And usually that's, you know, that's in the methods section. Sometimes you'll find the first few sentences of a results section, they recap who the subjects were. But anyway, they're going to be defining who's included, who's excluded by age, complications, treatment, whatever it is. And so we want to know how many subjects, we want to know what their particular characteristics were. And that's the next slide, I'll get to a point about that. And then, okay, here's how this looked then from the ProsEd article. And so, as you read, that involved 4 patients with PROP, but specifically they were healthy and metabolically stable. And they were admitted to the Clinical Research Center for this prospective study. Now, lots of times under this column, you're going to have more information about age, for example. But if you read this article carefully, they never did tell us what the age of these 4 patients was. Next slide, please. Okay, so what are we going to be using this first column, the sample column, for? And we want to be able to have each one of these papers identified as to what group or subgroup of people was studied in this paper so that we know which other papers we can compare it to. Or we want to look at a whole host of whatever the number of papers are that might have looked specifically in infancy and what happens during that very rapid growth that takes place during the first months of the first year, for example. Or maybe questions relate to how do we manage adolescence and whatever. So the first column is helping us pin down who's being studied in this particular group. What are their characteristics? Do they have complications and so on? Maybe it's going to tell us something about the spectrum of the PCC deficiency. Are they, you know, very severe, or do they have a more mild variety? They might also in that column be saying this is talking about 55 patients who are tube fed. So anyway, that's the kind of thing you'll be thinking about as you're in the first column on the table. Next slide. So we go then to the second column, which is intervention and factors of interest. And again, the heading of the column says intervention. But you have to think beyond that because a lot of papers don't necessarily talk about a specific intervention that's being studied. So I want to talk about that just a little bit. When we're looking at a single paper or when we're looking at a whole group of papers together in order to come up with some conclusion, we're thinking about what do we do, what's caused, and if you look back to your questions, every one of those questions says positive outcomes. So we're really asking what are the things we can do, what are the causes or things that would lead to positive outcomes. And here's some examples of that. For example, there's questions about grams per kilogram of natural protein or medical food or supplementation. That leads to certain biochemical parameters or other outcomes. Or we might be looking at metabolic decompensation events and the impact of those, the accumulated number of events that might impact growth and IQ and so on. Or another example, a particular intervention and how is it related to outcomes or something else. And so under this column of intervention, factors of interest, we want to define what it was we're looking at and again, pay attention to how it might be expressed, measured, and so on. So it says there, include the specific way the variable was defined. So it might be specific serum parameters or specific age, or it might be, you know, something examined over time. For example, if the research question was something about how do metabolic decompensation events relate to growth in IQ, then we want to know how were they counted. Are they talking about events during the first year of life, or are they talking about all events up to age 6, or what it is? So it's that kind of specification we're interested in having. The bottom line here says what other factors are used to adjust for factors that could mediate the effects being studied. And so when we're looking at cause and effect, and especially in very complex disorders, we can look at one particular thing, but you know that there is so much else going on in the management and treatment and adherence and so on of these patients that we have to say, what else should we watch for and track in order to look at the relationships that are being studied in this paper. Next slide, please. Okay, in this slide, and I know you're familiar with this, but I do want to emphasize it again because it's when you look at these papers, a lot of time you're going to be saying, what is it I should put in the intervention column versus what is an outcome? And sometimes it's not so clear. But I wanted to just remind you that in kind of classic or traditional research, there is this causal factor. There's some intervention or treatment, and that's applied, and then it leads to some change in some outcome. And so you were able to see that in the paper that you read for today, where there was a prospective study. They gave them a particular thing and then could see what happened in the future. Those kinds of studies are kind of the gold standard for being able to draw conclusions about, what kind of treatments are attached to or lead to positive outcomes. But of course, the unfortunate thing there is that there are not very many of those kinds of studies out there. And so there might be more papers that look at the factors of interest, so it might be characteristics of the patients or influences or some kind of clinical management, and then they're talking about the attributes or traits or whatever the outcomes were for this group of people. But they're just observing at a point in time, and if they have various quantitative measures, they might say, when this much of a certain factor happened, we see it's associated with this much of an outcome, or this level of a metabolic, of a biochemical measure or whatever. And so those are association kind of studies, and there are quite a few of those. And then the bottom square there says just descriptive papers that talk about the clinical course and the treatments and the outcomes kind of all together. But those kinds of papers don't have the ability to do, say, any statistics, for example, about what leads to what or what's associated with what. And so we have a whole, maybe a rich description of a case study, a very rich set of information, but we can't from it really deduce cause and effect, even though so much that's what we really want to know. But by this process we're going through, where we say these are the interventions that happened, or these were the factors of interest, and over here, these were the outcomes, when we put together a lot of information from various papers, then the work group has more to go on in order to say it appears that there is the relationship here, that doing these kinds of things leads to that kind of an outcome. So that's what we're working toward, and this slide really represents kind of the importance that you have in reading the papers and looking for what goes under the intervention column and what goes over into the outcome column. Next slide, please. Okay, when I think about interventions in research studies, I think about the modifiable factors versus the non-modifiable factors. And the modifiable factors are commonly kind of things you might see written about in the paper or might be part of some of the questions that you have. For example, different diet prescriptions, different choices and combinations of medical food and supplement use and so on. Bacteria flora, blood targets, and so on, activity level are all things that can be changed with interventions. Over on the other side are things that can't be changed. They're just a fact. The age, the genotype or phenotype, the PCC deficiency, their treatment history, blood levels in the past, socioeconomic factors. So those are things, again, that goes back to the kind of things you control for. And so we want to pay attention to what are the characteristics of these studies, people being studied, maybe based on some of those. What did those investigators in that particular study tell us about any of these things? But then over on the right side, the modifiable factors might be where we think about the places we can glean information that tell us about adjustments that could be made in clinical practice that could have an impact on outcomes. Okay, so you hear me kind of rambling on about all of these things, but this is just to kind of tweak your memory back to when you had research courses, and some of these concepts are probably familiar to you. But I just want to show you how this becomes important in this job that you have of abstracting. Next slide. Okay, so after that long-winded description, you see here our article from Prasdad and what we would put under the column listed intervention. And so what we know in this particular paper was that they started with 4 people who were on a normal diet, including carnitine supplementation. And so they had them, and they had them in a clinical research center where they could watch them and manage them and measure things. But so they could see what happens in their normal diet over a 4-day period. Then they introduced the Senokot syrup, and they were interested to see what would happen 3 days later. Now, so what I put on here is the Senokot syrup, and I included there that it's 8.8 milligrams for 5 milliliters. So we're kind of knowing in quite specific terms what the intervention was. And then further, the dose was dependent on the age of the child. So there was this much given for children under 5 and this much given for children over age 5. So here I have some pretty specific information about the intervention. Next column. Yeah, we're going to go to the next column on the next slide. Yeah, here we go. Thanks. Okay, so then we're into the third column, or the outcomes column, findings. And to answer, or to gather the information, you're going to be looking in the results section of the paper. And here we're interested in what effect or outcome was studied. And I use that term effect. That's kind of when we're lucky enough to have a cause and effect kind of study. But a lot of times we don't have that, but we're looking at what are the things that are on the outcome side of managing individuals with PROP that we care about. And so here we're going to have information of what they studied. And again, we want some specific information about the way the outcome was defined. So it's not just, say, IQ, but it's IQ measured using a specific kind of test at age 6. And again, the importance of that is so that if there are 3 articles that are looking at the effect of something on IQ, we can see if they're using the same kind of test or if they're using different kind of tests. And it helps us know how to pull that data together. We want to know what the results were, list the key findings. We're interested in the relationship of the causal factor to the outcome. Note if the actual numbers included in the analysis is not the same as in the original sample. So maybe 55 people were identified as eligible for the study, and maybe they studied 15 different things, including, say, lots of biochemical factors and dietary treatments or whatever, and then they're going to do a statistical analysis to look for an association. But lo and behold, they can only do that for 33 people because the other 20 didn't have the data in their medical record, or it was, it was never measured or whatever else. So again, when we're looking at the findings of the study, we don't say that we know that about 55 people. We might point out this particular finding is based only on the 30 people. So, you may not come up with that very often, but it's just to point out to you that that's something that you could be attuned to for watching, attuned to watch for. Okay, next slide. Okay, so here is the outcomes from the article that you read. So they got the Senecot and bowel movement frequency increased. Transit time decreased, and you see the numbers there. And there was a significant correlation between transit time in ammonia and transit time in propyl glycine. And there was also an association between ammonia and the propyl glycine. So, it's kind of telling us these are different things that came out of the study. Then I also put down here, then in this study, ammonia dropped this much, and that was a significant decline. The propyl glycine dropped this much. That was also significant. They also saw that free carnitine and total carnitine increased. So you might say, well, do I need to get all of that detail? I put that down because I'm not an expert in here, and I wanted to be able to stop and think about what does an ammonia of 88 mean? And if it got down to 61, what does that mean? Is that good enough, or how do those numbers relate to norms? Or how do those numbers relate to guidance that is out there about what levels of ammonia you should aim for? So having the numbers on there gives information about how big of a drop can you expect, and it also gives you information about, is it clinically meaningful? Did you get enough of a drop to bring them into a desirable range, for example? And again, you'd have this information and relate it to other studies that looked at gut motility. The other thing I put on here at the bottom, there was no difference in symptom frequency, so there wasn't any more gagging, vomiting, and so forth. Okay, that's the outcomes. Next slide, please. So what outcomes are important? What would you be looking for in the papers? And these were mentioned in the previous presentation by Elena and Kiko. But, of course, growth is important, the various measures of metabolic control, nutritional status, and various indicators, psychomotor or neurocognitive kind of things, development, and so on. Bottom there is reversal of previous adverse effects. but so outcomes are things that are important to PROP. And again, thinking back to that slide, when we have the papers that don't really say this is causing that, you really have a descriptive paper, you're going to be looking at all the information in the paper and say, what of all those things they're talking about in this one patient or this case series of 7 patients, what should I put down here about the various outcomes? What should go in the outcome column? Okay, next slide, please. The other thing to point out and remind you about is that risk and harms is another thing that we're interested in, because outcomes can also be negative, or some kind of interventions might have side effects that are undesirable, and so we want to know the degree to which those might happen. And so there might be undesirable or unanticipated consequences, or some negative impact that this particular thing has on an aspect of nutritional or health status, or economic or financial burdens to the family, or other kind of things. Now, when I'm thinking about the particular paper you read, the bottom line of that outcomes column, I said, they noticed no increase in things like nausea, gagging, and whatever else. Maybe some people would consider going from 0.75 bowel movements a day to 3.5 per day as a negative outcome. I'm not sure, but you could also think about it that way. How could these outcomes be translated? That's kind of a light example of it, but a serious example of it would be if a particular treatment modality happened and it resulted, say, in some serious consequence related to growth or whatever else. But so we're looking at the desired outcomes, but we're also mindful of did this particular thing result in any risks or harms that need to be balanced and considered in looking at the data. Next slide. Okay, so coming back now to the two columns, the intervention and the outcomes. Each prop project research question focuses on different factors of interest and might emphasize different outcomes. And you're going to get a set of papers, one paper at a time you're going to look at, and you're going to be relating it back to one of the prop research questions. And what I want to point out is that the author might say, the purpose of this paper is to blah, 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 blah. And the purpose of that paper may not directly be what we're interested in one of those 7 prop research questions. But your job is to sort out from that paper what it is that is relevant. And so you're going to, when you get an article, it's going to depend on the question that you have assigned to the article. For example, if it's a question 1 paper, you're going to be particularly zeroing in on nutrient intake requirements, kind of in general, what are the requirements the nutrient needs. But if the paper is assigned to question 2, you're going to be looking at what are the nutrition interventions for individuals to meet those requirements, or what are the kind of decisions the dietitian has to make in order to help that patient, meet whatever their nutritional needs. And then as opposed to question 3, which would zero specifically in on the use of the supplements in their treatment plan or other kind of treatment modalities. So again, just pointing out what you would be zeroing in on in a paper, and that might contrast from the author's explicit reason for them writing that paper. Next slide, please. All right, now we've got through the first 3 columns, which are the columns where you're taking the facts off of the paper as they're presented there, and we're moving to the columns in which you really draw on your expertise and your experience to do some kind of thoughts and reactions to that paper. And so under the limitations column, we're going to think about limitations of the study per se, but also kind of as you look at that, what are your reflections, what kind of reactions do you have that might be important to the prop research question? So you might think about the study and how it was conducted and list any important limitations that could be considered. And then there might be things you see as like, boy, this seems kind of weird the way they did that or measured that or whatever. But also, many times the author will actually be upfront and in the discussion section might say this is kind of a limitation we dealt with in the study. So when you're abstracting, under this column of limitations, that's what you're looking for. Then note things the work group should keep in mind when using the evidence from this article. And again, so here's just from your experience and whatever, you can say, yeah, but this is something else that may occur we need to know, say in relation to using Senecot, for example. So you're drawing on your knowledge for interpretation or translation under the limitations column. Next step, next slide. Okay, so here we have what might be on a table for our process article on transit time gut motility. So one of the things was they started with 4 patients in the study, but they did say that the transit time could not be measured in 1 patient. And so now that's you know, helpful to know that this ended up really being a study about 3 people versus 4 people. Kind of a weakness of the study. But then another thought that comes to mind, or another thing that you might point out about this article, is that the outcomes of long-term use of Senecot are, you know, we don't know what happens if people use this for 2 weeks or 4 months or 3 years or whatever else. So this is really only a study of 3 days of it and the immediate reaction of the gut in 3 days when this is introduced. So we don't know what the long term would be. The other thing is this is a study of a very gentle kind of laxative, and from it, we can't make assertions about any other kind of laxative. So here, this is, you might just put a reminder here of some of the things about that would relate to the use of that study. And then, let's see, I guess we're ready for the next column. Next slide, please. That's the last column is evidence to inform the question. And here you're saying, what's the takeaway evidence that will be used to help answer the question? So we've got this paper, and we want to bring it together with the 5 or 6 other papers on laxatives. What is this particular paper going to tell us? And then here, you don't have to write out the data that appeared under the outcome column, or you can just say, you know, as listed in the other column. So your job can be a little bit lighter. Don't repeat stuff that's already there. All right, next page. So here's what might be said for the article you read. A takeaway message might be, in healthy prop patients, the addition of Senecot led to significant decrease in ammonia and propionyl glycine levels. Okay, bottom line, that's what they found. And then the previous column, you reminded them that that's what happened in a 3-day study. Next column, please. Or next column, next slide, please. All right. So if you put all those pieces together, this is what the table or the worksheet would look like. Got all the information from those 5 columns. Next slide, please. Okay, so how to get going on this. So here's some 4 steps to abstracting. What I would suggest is you get your article assigned to you. The first thing you do is kind of scan through it quickly to kind of get the gist of what it's all about. Then you would think about, how does the information reported here relate to the research question that was assigned to it? So is it a question 1 about nutrient needs, or is it a question 3 about supplements? Or in this article that dealt with both of those topics, I got to think about now, how am I going to sort out what to answer each question? So then you go back and read the paper more thoroughly, and you're going to find the relevant information to abstract onto the worksheet. And there is a page we're going to provide for you called the Guide for Abstracting Research Articles. And basically what that is this table and a lot of the points I mentioned in my presentation today to remind you what goes under each column. And then you enter the data. And then remember that the first 3 columns, you're getting just the facts, And the last two columns is where you're putting on your expert hat to say what else should be kept in mind here as we're using this article in our project. Next slide. So what if an article is assigned to multiple questions, and many are? And in that case, you do a separate worksheet for each question. And then, as I've said, they will ultimately be brought together question by question. And so that's why we put information related to question 1 on its own worksheet and information related to question 3 on its own worksheet. There's kind of a shortcut for you, though, is once you figure out what goes in column 1 to describe the population, for example, you can just cut and paste that and put that into the next worksheet, because that's probably going to be the same for all of the questions. Next slide. Okay, so here's an example back from PKU. Back up, there you go. It just shows a different worksheet result for question 1 versus question 3 versus question 4. And if you look there, you don't need to look at the detail that's written there, except just I want to point out that actually that's pretty concise, not really long, lengthy kind of information. So even though in my presentation right now I talked about a lot of detail and think about this and do that and include that, when it comes down to it, you're going to find maybe a small piece of information or a specific piece of information that goes on this sheet. It may not go on for forever and ever and fill a whole long column. Sometimes it will, but often you're getting a smaller, your worksheet is looking like this. Or worksheets for 3 different questions might be shorter, some might be longer. Next slide. Okay, so how long does this whole thing take? And I would say, to begin with, aim for completing an article in an hour or so. And then you'll find as you do this, you're going to get better at it and be more aware of what to look for and so on. And then your time is going to drop from 40 to 30 or even fewer. And as you do more articles, it'll go faster. But we're going to give you a homework assignment to do for the next call in 2 weeks from now. And so I think you should allow at least an hour to do that assignment, maybe a little bit more. And then you can also be thinking about, in my life, where am I going to find the hour or 2 hours or 3 hours over a period of a couple of weeks that I would be able to look at the articles I get, to abstract them and turn them around. So the assignment is let's do it, but the assignment is also to think about how you'll be fitting this into your life, where you can schedule the time and so on. And another thing about how long does it take is it does become easier if you work on a set of articles that are answering the same question, because they're kind of attuned to what are the factors that are important in the supplement use, what are the outcomes that typically are measured and looked at in supplement use. And so that is easier, and I think that when articles are assigned to you, there'll be some attention to trying to give you a set of articles that answer some of the same questions. So that's something that makes the job a little bit more efficient. So that's how long it takes. And next slide, please. Okay, here's your assignment. So we'll be sending you a specific article, and your job is to abstract the information from it. It happens to be an article that actually has been assigned to 4 questions, or maybe even 5 questions. But for the case of this assignment, we want you to complete a worksheet for question 2 and question 3. And we'll give you the blank worksheets just in a Word format, and so you can just work, on your computer using Word documents or whatever. You don't at this point need to worry about using portal, or how am I going to put this on the computer. How am I going to put it onto the portal? That'll come in the 3rd training session. And so we'll also have this guide for abstracting the research articles, and also we'll send you the example from the one we just talked about today. So that's the next phase, we throw the ball to you and let you practice on another article. Next slide, please. So that's the end of it, and we're opening the floor for questions.
Thank you to all the speakers. The couple of announcements I'm going to make before we open for the questions. One is we will be posting all these slides on the portal for you to have access to, and we did take today's session, so that would be available should you need to go back and see what any one of us said. Also, the speakers' contact information would be sent, and we are accessible after this session to you. Anybody who's participating in this project, and you know the roles through the organization chart. We also are going to use the discussion board most of the time to communicate with each other so everybody else can see what issues and questions are coming up, and it can be tracked in case we need to go back for any issue. So I think Adria can reinforce that use of discussion board. In fact, H had already started a topic today, and also Adria will be writing a little methodology how to use it to supplement what we are going to discuss today. So for now, I will go ahead and open the floor for any questions related to any speaker. Tell your name and say who the question is being addressed to. All right, it's open. It's all yours. Anyone has any question? Gosh, are you very overwhelmed?
Are you all awake out there?
This is Julie. I just have a question for Pat. I noticed that you didn't add in the ages for the 4 patients. Was that because it was specifically in the abstract only?
No, I didn't see the ages in the paper. Did you see them?
Well, they were in the abstract, but not in the actual text. So that's the one question I had. Is that okay to use that information there?
Yeah, I guess that would be okay. Right. Right. Yeah, if it provided you information, I guess I wouldn't exclude it.
Right, additional information, but don't use it, you know, exclusively. I get what you're saying with that.
Right, that's it.
All right, thanks.
Is the process pretty clear to you all? I know we had started this work group and there were interruptions. Hopefully we have taken care of the bugs, and I would like to hear any comments too. It doesn't have to be questions. Your reaction, what you'd like to see in more help with, or
This is Christy. I had just kind of a logistical question for Adria if she was on. If we did have, do we need to set up a whole new like username and password if we had one originally, or should we try to use that one?
If you previously signed up for a CERG account, then you would use that old CERG account. If you've not logged in since 4 or 5 months ago, you're going to need to reset your password using the password reset tool that I mentioned earlier.
Okay.
Okay? And if you forgot your username, for some reason you need some help with that, or you don't remember what email address you used to log in with, I can help you with that much. If you want to contact me off-site, I think I'm on some of the emails that have been circulating.
Okay, thank you.
Okay.
So, do you?
Yeah.
Go ahead, Diane.
Ronnie, this is a comment. This is Diane, and it's just one thing that I'm not sure I heard in Pat's wonderful presentation, but there's occasionally an awfully good table in a paper that gives a lot of data that you could actually just put in table 4, page XXY, and then when the writers of the recommendations get to it, they can actually go directly to the table, and it does save time on the overview table. I wouldn't say you do this on every one, but occasionally there's a table that is easier to look at the table itself than to try to pull all that data into this overview table.
Okay, thank you, Diane. Since nobody has questions, I'm actually going to call name and ask you to give me some comment name by name. So I'm going to start with Amy Thompson. Amy, what is your reaction, and is there anything you feel specifically from your perspective we need to be doing to help you?
No, I think I just want to kind of get going and start with it and just see how things work. I think this is a great presentation on how to use everything. It's going to be really interesting to get the information. And I can just say from a clinical standpoint, I can't wait to get this information because I'm trying to handle a PA patient and I want to know what everybody else is doing. So
oh, that's great.
It's going to be really helpful for me too, just going through the process.
Fantastic. Bridget?
Can everyone hear me okay? Yep, I am. Can you hear me okay?
Yes.
Yes.
Oh, good. Thank you all so much. I am really impressed with the portal and how this was all set up. And Pat, your presentation was so incredibly helpful. I think we all read research articles and internalize them in our own way, but to have a structured format and to know what you're looking for and that we can streamline it as a group is really exciting. And I really look forward to being a part of this project. So thank you for having me.
Oh, we feel lucky to have you, so that's great. Okay, Christy?
All right. Hi, everyone. Yes, thank you. I also second everyone's thoughts, and the process is really it's very logistical, and it makes sense, and I think it will have a really needed and useful outcome at the end of it. So yeah, but I think going through the process, I can see how the first one will take longer, and then hopefully it will get more streamlined as you kind of go through it. So yeah, I think it'll be a learning curve for me going through the first one, and hopefully it'll get more easier as I go through it.
And one of the end products which I forgot to mention, which is very critical, I might have mentioned, there will be a publication like Diane's for MSU Day, and we are working on the PKU. There will be a publication with all of you as co-authors for propionic acidemia also. I know I forgot to mention that, so it should be very exciting to filter out all this information through your efforts. Okay, Julie?
Yeah, no, I think everything was great. All the presenters were fantastic, and it's nice to kind of see I've seen various pieces of the puzzle before, so it's nice to see all the pieces kind of fit together. So no, I'm excited to be working with the group.
Okay. Laura?
And thank you for having me on this project, like other people said. I found going through the sample paper along with Pat's presentation was very helpful. I think it is a very overwhelming process, but it was nice to break it down that way, and I'm really looking forward to getting started.
Yeah. So I think while it's great, the focus is on how to do this article, you will also hear in another week after next session, in the third session, how to use the infrastructure, which would make things even more efficient for you. So we are hoping we will walk a little bit of a piece at a time while giving you the overview picture. Matt?
Great.
Yeah, I enjoyed the presentation also, and I think it'll be a great opportunity just to really dig in the articles and kind of increase the expertise in PA. I just had a quick question. When will the articles start to be assigned?
We anticipate you being assigned to articles after November 21st.
Okay, thank you.
And they will be available through the portal, so we want to be sure you know how to use the portal before we.
Right, and just a quick word, we're going to go into greater detail on how the portal works on the 21st, but just a quick summary, the articles will be assigned to you, and you'll have email notifications letting you know you've had so many articles assigned. So you'll get at least email notifications as the process gets started.
And Matt, the practice article to prepare for the next session, that will be sent to you today after this call. So you'll get a PDF of the article, you'll get a blank worksheet in Word to do the abstraction, and then that would be what we'll go over during the next presentation with Pat. That will come after this call.
Okay. Any other comments, Matt?
That's all. Thank you.
Okay. Lisa?
I think my comments are a lot of what everyone else said. I'm excited to start. I think thus far things seem clear. I'm sure there'll be questions along the way. Excited to get started.
Is Stephen Yanachili with us? I didn't see his name up there. I'm not sure Steve was. Steve, are you there? No. Okay, Anne Marie?
So I'm super excited with this project too. I started with this project when you guys first started, and then I had to drop out after I had a baby, and so it's really come a long ways in those last couple of years. So I'm excited to get back into it and review some articles and see what we find.
Hey. Yeah. So Fran, do you have any comments?
No, I'm glad you mentioned that this is going to be on the portal, because I found when I started actually doing the articles, it was really helpful to go back to Pat's notes and remember, oh, what was I supposed to put in that column? So that was really helpful. But mostly, I'm just really proud to be part of this. I think everybody did a great job, and I think we've come a long way with the process and the infrastructure, and we're so ready to go. It's really exciting.
All right, so thank you, Fran. I think what I'm going to do is, before we close, I'm going to show you the discussion board again, because I can't emphasize the importance of our communication through the discussion board. So not only the work group chairs, but the core group and other people can keep up. And we want to be sure to give you timely help rather than communicating emails with each other. So I'm going to have, before we close, in the next 5 minutes, I'm going to have Adria demo a question to you, how to use the discussion board again.
Right. So again, from our earlier presentation, we're actually live on the portal right now. So this is the portal homepage. I've just logged in using the login link at the bottom, and you can see all the different buttons on the navigation bar. So at any time from any page on the portal, you can always go to work groups and go down to discussion board, and that will open up a new tab. Right now, I'm not logged into the discussion board, even though I am logged into the portal. So there's a different login, but the login credentials are identical. So if you put your same username and your same password, and you can check off here, log me in automatically each time you visit, and you'll log on to the discussion forum. So this is the list of forums available on the discussion board, and you'll see there's a phenylketonuria work group, amino acids, et cetera. You'll be working out the OA work group forum. So just click the link, and now we're inside the organic acid OA forum, thank you, and the list of topics here on the left. And the person who posted the topic is on the right. And you can see the number of replies to that topic. So yesterday, Aisha created a topic specifically for questions about this training session. And you'll see that topic is at the very top of the list right now. So if we were to click that topic, we would then read the text that Aisha entered. And if we happen to have a question, then you click on Post Reply, and you would ask your question here. And you would click Submit, and your question would appear here. So that's basically a quick shortcut on how to use a discussion board.
And will other people get this immediately?
Right. So once you get logged on to the discussion board, I'll provide more detail in a presentation I'll send to you because it is a little overwhelming to get everything at once. But there is a method that you can subscribe to this forum and receive email notifications each time a new topic is posted. So on the forum page for the OA work group, you'll find a subscribe link. I can find it. Okay, so at the very bottom of the forum, I've already subscribed to this forum, but if you click on subscribe forum, what you will see, that will subscribe you to any new messages that are posted. You'll get an email notification saying that H had posted a new message or Jill posted a new message, so on. And you'll be able to go and view that message and reply to it as you like.
Does that help? I mean, the group pretty much gets that we'll use this instead of sending individual emails. That way, if Julie asks a question and Fran has taken the time to respond, other people can read. And if you're on the forum, you'll get an email that this was posted, and so you can go back at your leisure at night after work or during break time to view it. So that way, we'll have a tracking of the responses. And so I'd really encourage you to immediately enroll for this part. Any questions moving forward from now on that come, let's all make it. And if you have any trouble, just call Adria and she'll help you.
Yeah, so just to recap, Adria will send some directions and just some how-to guide for the forum. Once you get that, just log in and subscribe to that forum so that you actually get the notifications. If you're not subscribed, then you wouldn't get any emails.
That's right. So that's correct. So just look for an email from me. If it doesn't come today, it'll come early next week, and I'll have a very short, concise instruction on how to get set up and use the discussion board.
Okay, thank you, Adria. So one last call for any questions or comments from participants or presenters.
This is Pat. This is Pat, and I just want to invite you to complete your homework assignment, and in the information will be my email address. So if you can send your work to me on the 10th or 11th of November, when we do the training on the 13th, I can respond very specifically to experiences that you had doing this abstracting process.
Very good.
If you have any questions or issues getting registered or creating your account, feel free to send me an email. I'm on a couple of email chains that went out yesterday, so feel free to contact me. My phone number is also there. You can feel free to call me if you prefer.
Okay.
I'm sorry, Adria, is there still time to show them where these slides will be on the portal?
Sure. I think what we'll do just for the time being, we'll probably send these slides out via email.
Yeah.
There's a lot to take in.
Yeah, I think what we'll do is we'll go this first batch of slides. We'll send it to. We have the email address of all the work group members until Adria does the portal training. I just don't want them to get frustrated looking for this information. So we will go ahead and send it as an email attachment to all the members along, with the other things, so that after the portal training, we'll start posting with different things are. If that's okay with you, Keiko.
I think that sounds great. Thank you.
Okay. All right. I think I'm very proud of the team for keeping us on time. We are actually 10 minutes early. That's usually unheard of with our meetings. And thank you very much, and we look forward to being with you again shortly in a week or so. Okay.
Thank you, Ronnie. Bye-bye.
All right. Bye-bye.
Thank you, everybody.